Hi everyone, I'm Michelle Rybar, and thank you for the opportunity to speak to you today on behalf of our entire Eye Care and Vision Research Work Group to give our first year update. So just like anything in Odyssey, our first year has been a journey, and I'll talk to you about how we got started, our initial steps, some milestones we've achieved, and now looking forward to our journey ahead and the next steps. So we got started in the spring of 2022 because it was a need was brought up by the American Academy of Ophthalmology, AAO work group on data standards. And this was mostly coming out of the desire for eye exam data to be included in data generation projects like All of Us, N3C, and Bridge to AI. And we quickly also discovered that the source terminologies hadn't been updated in a while, so there was missing concepts there as well. But our overall goals were to create access to large, diverse data sets of ophthalmic and systemic data to enable research in both and also at the intersection. So some of our initial steps were we identified tasks and then created subgroups for those tasks, and also subgroups that were aligned with different subspecialties of ophthalmology and optometry. We recruited colleagues to participate, and the National Eye Institute, along with the National Institutes of Health, created a data scholar position to help with this project. That's me, and that has been one of our main supports and ways of getting this done this year. So the milestones we've achieved so far is that as of a week ago, we had 122 registered members on Teams, and we'd say roughly 40 of them are active, attending work group meetings pretty regularly. And of those, we had 13 trainees and 10 interns from the Bridge to AI, AI Ready project. We're a multidisciplinary team, mostly consisted of clinician scientists, ophthalmologists, and optometrists, but some informaticists like myself and some other vision scientists. We've had meetings at least once a month, sometimes twice a month for the whole work group, and then meetings for each of the subgroups. So we've met quite a bit this year. And I can tell you I've had countless ad hoc meetings. I couldn't even, probably at least once a day. We quickly found out that we couldn't do this on our own, so we're really grateful for the Odyssey community for being there for us. And so we've regularly collaborated with many of them, but we've also collaborated with external organizations to make sure that our efforts are aligned with the needs of the community, but also so that people are aware of what we're doing and to drum up kind of support and interest. Also to help us get some of those concepts addressed. So several groups within our work group started looking at mapping those elements. And so in total, we've looked at over 3,700 ophthalmic data elements, and we've looked at 2 EHRs, Epic and Cerner, as well as looking at different ophthalmology textbooks for source concepts. We're in the process of getting concepts added to both SNOMED and LOINC. And this is just an example of one of the graphs from our Epic EHR concept matching paper. Poster 8 has information about both Epic and Cerner, but this graph is pretty similar for Cerner as well. And you can see that roughly only 25% of the concepts had an exact match in an underlying source terminology. And the majority were either missing or did not have a specific enough concept. In ophthalmology, one of the most common things that was missing was laterality, which is really important for your eye because you really need to know which eye has the disease. But there are also other specific modifiers for concepts that are really important in terms of how measurements were made or different methodologies that were missing. So we've really tried to get the word out that we're doing this great work. So we've been publishing papers, both that have summarized our work, but also kind of advocated for better standardization. We have created some iWiki pages. That's a wiki that's maintained by the American Academy of Ophthalmology, and that's sort of educational for that community in terms of what standards are and the work that we're doing. We've done a lot of different presentations at conferences and ophthalmology departments, posters, including a couple here, really trying to talk about the work that we're doing. And we've done almost all of it entirely through volunteer effort. So the support pretty much solely has been from the NIH with the data scholar position. And we're so far have 2 grant submissions, but haven't heard back on them yet, but we're hoping to have many more this year. We were really thrilled that Cindy Kai, one of our workgroup members, had her project selected for the SOS Challenge this year. And she's already talked about that, so I won't necessarily go into the details of it. But I will say the thing that has been really exciting about it is that as Cindy and myself have presented this work to the larger eye care and vision research community, they have been really excited and really see the value of this approach. So we hope that we can have, maintain this momentum and have more network studies this year. So the next steps as we're looking ahead is we really want to pilot some of these new data elements that we're working on mapping. We have a set of about 5 or 6 sites right now that are in the process of getting those data into their OMOP data mart. And we're also looking at integrating ophthalmic imaging with our data marts. So we're getting started on the first steps towards that process. This year, we're really focused on more of the community outreach to make sure that people know what we're doing and to get more people interested and involved. And as I mentioned before, we're hoping for more network studies and for more funding support. So like any journey, we've had some roadblocks or traffic cones, and we've had some challenges. Probably the biggest one is just finding a time to meet. With busy clinician scientists across multiple time zones, we often can't all meet at once. We also have had trouble with these concept modifiers and sort of adding things to the source terminologies. So for example, we just submitted over 200 concepts to represent very simple visual acuity concepts within ophthalmology. And the problem is there's so many modifiers. You can imagine laterality, distance, whether or not you're wearing glasses, and so it quickly expands. So we're working with LOINC to figure out a way to manage that. Also, as I mentioned, we've had limited resources this year, but we're hoping to change that. And we're also hoping to expand sort of our membership beyond just academic medical centers. So in summary, we've had a very productive year. It's been great fun working with everyone, and they're all over there, so they're great too. And we're working really towards our goal. I think we're going to get there, but we still have a lot more work to do. So please join us if you're interested. Our work group meets on Sunday from 1 to 5 p.m. And you can also see more information at our poster. And I'd like to thank a lot of the people here, and I know I've probably left people out, but a lot of people from the Odyssey community, the entire work group, and especially our co-leads, Carrie Getz and Sally Baxter, and the National Institutes of Health to help support this through their Data Scholar program. And if you want to find out more details of what we've been up to this year, you can come by our poster number 510. Thank you.